My name is Anna Skendo, and I'm going to be presenting on CNN models in dermatology access and diagnosis. A little about me. I'm a rising junior at Troy High School in Troy, Michigan. I heavily participate in DECA, for which I've competed internationally. I engage in HOSA, where I've earned 4th place statewide in a speech regarding health inequities. I'm super passionate regarding Cancer Kids First, where I aid young patients, and I'm also vice president of a business operations and investing club. In my free time, I like to research dermatology innovations, and in the future, I want to pursue business and computer science to delve into the implications of those in global health. Today, I'm going to be discussing the impact of dermatology on global health and individuals, dermatology inequities in underserved areas, and the role of CNN models in the reduction of those inequities. So what is global health? Global health is an area for study, research, and practice that places a priority on improving health and achieving equity in health for all people worldwide. Skin health is often underestimated in global health conversations, but it shouldn't be. 900 million people globally are affected by skin diseases at any time, and skin diseases are ranked the 4th leading cause of non-fatal disease burden worldwide. Although people dismiss them as merely cosmetic, they pose a significant threat on well-being and mental health. 27.2% of people with skin diseases stated that their skin condition worsened their quality of life. As the data to the right shows, the visibility of the skin condition contributes to this percentage, further reflecting the emotional toll of skin conditions. The effects of dermatological conditions such as acne and eczema fall under 4 key branches: physical, mental, social, and economic. Physically, skin conditions cause chronic and persistent itching, leading to pain and inflammation and later scarring, open wounds, and a potential for bacterial infections. Mentally, they induce psychological distress in forms of depression, anxiety, and isolation. Socially, these individuals withdraw themselves from going out to avoid bullying that arises from people labeling them as different. This causes relationship and self-image issues. As for economic impacts, there are indirect costs of lost productivity for missed school and work due to factors like discomfort or stigma. There are also direct costs for medical and travel expenses, and a long-term financial burden from a chronic care cycle. Underserved areas face the worst of these inequities due to the lack of access and diagnosis. Primarily, individuals in low-income regions cannot afford doctor visits, prescriptions, or transportation to urban clinics due to their geographic isolation. Their poor economic stance isn't the only inequity, however. Even if a clinic is near a said patient, the care they would receive is under-resourced and undertrained, as most skin issues are handled by general physicians. In Africa, there are less than 1 dermatologist per million people, compared to the 36 for the US. Additionally, many low-income clinics lack necessary diagnostic tools like dermatoscopes and medical records. Health literacy is also a great concern. While patients in the US are likely to recognize symptoms of skin conditions early, many patients and caregivers in underserved regions lack knowledge, leading to delayed care or harmful remedies. Lastly, and very important, dermatological care is often not emphasized in global health agendas. Public policy determines what gets made accessible, and right now, skin health simply isn't on the radar in many countries. This way, millions are left untreated, not by chance, but by design. Before we discuss a solution, let's look at Ethiopia. In 2019, Italian researcher Paolo Monari collected 467 samples from patients in the dermatology sector in the Axum Referral Hospital. She observed skin diseases and discovered a direct relationship between poverty and skill illness. Notably, people in large households with inadequate sanitation and housing, as well as low health literacy, had a higher likelihood of having skin conditions. Paolo also emphasized that buying 1 tube of medication is expensive enough, and the majority of people cannot afford to purchase 2 or more tubes of the medication, so they are unable to receive the proper treatment for their illnesses. At the 8th International Congress, Monari and other researchers presented findings on the stigma patients face and how skin diseases can often reflect more serious conditions. How can we build upon all this information and improve the representation in under-resourced regions? Scientists have long been looking for ways to make use of emerging technologies in the medical field. One model is a convolutional neural network, or CNN. CNN is a deep learning model well suited to analyzing visual data. It is frequently used for image recognition, and researchers have even been investigating ways to use it for classifying cancer cells. This model is similar to the connectivity patterns in the visual cortex, which essentially performs the same task but in our brains. The image below models how the CNN processes an image to make a prediction. A raw image of an individual is first submitted to the model to analyze. Then, the convolutional layers scan the image to detect patterns in the skin. All the multidimensional data is flattened into a single vector to prepare for decision making. The fully connected layers process the information and make connections to predict what the skin condition is. Each blue node represents a small decision point, thus building confidence in a diagnosis. Lastly, there's an output which provides classification labels like eczema, 91% confidence. CNN models can help low-income countries greatly. However, a big question arises on how CNN models can even run in low-income countries due to the lack of resources present. The key aspect of this concept is training these models on diverse datasets to increase the detection accuracy. It's critical to classify different skin types and skin conditions thoroughly, having all necessary information like the Fitzpatrick scale. This will improve the connections made throughout the identification process and bring global diagnostic power into these areas. Also, through global health campaigns and donations from nonprofits, low-income countries can receive supplies needed for this model as well as training and treatment. Lightweight CNN models can run on used or refurbished phones costing from $30 to $60, running offline to further lower the expense. Through the pre-installment of an application on these devices linked to the CNN model's output, all the information, including treatment recommendations, can be simplified and available to clinics as the image to the right indicates. Additionally, outputs can be translated into local languages, voice prompts, or icons. Heat maps can be utilized for clinicians to verify the predictions, and uncertain cases can be flagged to be sent to remote specialists for further guidance. Raising funds to provide appropriate treatment to these areas is also extremely necessary to fulfill this goal. To summarize, skin conditions are a global health crisis affecting millions. They are chronic and stigmatizing, therefore creating deep mental, economic, social, and physical impacts on patients. Access to diagnosis and treatment is very unequal based on the inequities underserved areas face. Nonprofits have been looking for ways to provide health literacy and financial and mental support. However, access and diagnosis remain issues. AI tools like CNN models for image diagnosis have incredible potential to improve health outcomes if developed in a way that is ethical and accurate. While further research will need to be conducted in order to look at the cost effectiveness, we have to keep in mind that we have the power to utilize these tools in a way that helps those that need it the most. In the words of consultant Peter Drucker, the best way to invent the future is to create it. So let's create an equitable future. From now on, educate yourself on dermatological health disparities and get familiar with different ways AI can improve dermatology in under-resourced areas. Look into organizations that bridge these disparities. Raise awareness to ensure needs are stressed in global health conversations to increase funding and aid. Any help you offer is greater than none. The future is simply in your hands. I'd like to thank the GHLC for giving me this opportunity to speak out on behalf of this growing issue that I'm truly passionate about. I'd also like to thank my family for always supporting me. These are my references, and these are my email and LinkedIn accounts if you've ever want to reach out. Thank you so much for listening.